with electronic medical records, medical imaging, healthcare data management, healthcare analytics, biology, informatics, and population-based health. Today, I'll be focusing a little more on the mobile health applications, remote monitoring, and telemedicine. As we know, smartphone-based apps have been coming into a lot of us today. This app deals with monitoring of a patient vitals, a medication reminder, a telemedicine, a lab test booking, and a home care booking. Now, as we know, in smartphones, telemedicine is an easy to access. It saves healthcare cost, non-adherence to treatment, personalized patient engagement, and a better quality care. One of the reasons why I had to, make an application is also because of the challenges faced. As today, we see so many patients coming with uncontrollable diabetes and hypertension. We have patients coming with compliance of medications, which has already been highlighted in glaucoma, access to doctors and follow-up checkups, disabled patients who are not able to come for checkups, senior citizens and long travel to hospitals. This is the application Remote Tel Health app. As you can see, once you download the app, there is a small registration they do with the name, email ID, and the mobile number. So this will help to create a validation of a unique ID for the patients. An OTP is come to the requested mobile number. And once the passcode is come and entered, the patient can get authenticated into the app. So once they log into the app application, this is a small profile where the patient fills up his history and details. Like once he fills his name and age, he has a few history that he is going to write in the app, which probably will be his details of his medications, any history of any blood pressure, cardiac diseases, and diabetes, any drug allergies. Once he has entered that, he can also add the family members in a single app, his brother, his grandparents, and it also can help to document a few health records if he wants to take and document it. Now we come to an interesting part, which is the health vitals. For most of the patients who use devices and have home check, they can enter their vitals in the house. And this is very important in patients monitoring for diabetes and hypertension. Here you can see the vital chart where he can enter his weight, calculating his BMI with the height, any temperatures, pulse rate, the heart rate, the SpO2.
Now I will show you.
And once the vitals are entered, you can also have a pain scoring.
It is added. I will show you the graphical chart.
There is a chart where he could see his timeline of the vitals on the last 3 months. So this is where the vital chart can help to understand where the spikes of the diabetic or the blood pressure has taken place. And here you can see the wearable devices which can be linked to the app. And this is a medication reminder app. Today, we all know what is the compliance of medications in glaucoma. So here we have a medication app where we can set the medication, the start and end time, the dosage, the frequency, and when to take the medications before and after food, and a few instructions are given below. You can see on the left side, I'm scrolling down the app. It asks every day, once daily or twice, the time in which the medication can be setted. One second. So once he sets the ringtone, and finally you can see how the reminder will come on the screen. And once he clicks taken, which shows that the medication has been taken. So once you click the button here in the screen, he can download the file and share it to the doctor and see the number of places and times that he has taken and not taken the medication. So this is very assuring to the patient for the compliance. The other is a doctor consultation, where the patient can book an appointment with the doctor, where he can type a few complaints, any other symptoms, and the vitals, of course, if there is any past medical history, the current medications, and then drug allergies. And then finally, he can book a doctor with the appointment time and schedule. And this is how the doctor chart will be. The doctor has a login ID, where the doctor receives the appointments and sees the consultations. He sees the completed appointments, and then he can join the call at the time required. And the doctor can see the patient's history and data if entered, his previous histories of allergies, and he can also ask for laboratory investigations. And he can also give a prescription for the patient. And this is a lab diagnostic booking, where he can book for the lab testings in case that the doctor has advised. There could be a home collector which comes. And this is a home care booking, which also books for the home care services at home. So finally, in the future, we're also looking at the remote monitoring of patient, integrating wearable devices, pediatric monitoring of patching therapies, an optometrist app which could be integrated for screening and eye checks, a vision chart for self-test, and an AI integrated analysis. Thank you. Yes, sir. Yes, it's a one-stop solution so that the patient can use all these applications in single app.
The patient has to pay anything for that?
As of now, there is no payment. As if at all the patient needs for the consultation, yes, there could be some charges which the doctor has pre-booked, kept in the appointment.
Can we monitor also?
Yes, we can monitor the patient's vitals. And of course, with our wearable devices, you can have a real-time monitoring which could be shared to the doctor after the patient checks. But of course, for real-time monitoring, you need a separate, application which can monitor in real time. But this could be recorded, then probably transmitted by a PDF file.
Is it area-wise or region-wise or state-wise?
No,
universal?
It is universal. The region-wise could be probably for the lab booking, which region the lab is there, and that lab could be tied up, and which services of home care is there around that area, which could be tied up for that.
Okay. Thank you.
Thank you, doctor.
So basically, you need doctors and the labs to join your network, and then only it can be provided to the patient.
Yes.
So it's a kind
if
of.
The doctors can join, or they can also use it as they are to follow up their own patients.
So there are various apps available in the market, similar kind of telemedicine and other things. So how does your app is different from them?
So in this app, you would have seen there is this vital monitoring, which has the vital graphs, which is recording over a period of time on the patients, so that early intervention could be created in terms of any spike and uncontrollable diabetes. There's a medication reminder. Normally, you may have a medication reminder, but here it is an online medication reminder which tracks every time the patient clicks taken, so that you know the compliance of the patient. So this creates an assurance of the patients to see that the patient has been taking the drops. One of the two highlighting features in that. And we have a home care which is collected to the regularized area.
So from what I gather, the patient has to have the app installed to take an appointment and then fill in the history.
Yes.
Wouldn't it be more easier if the whole appointment system and the history was through a chatbot on WhatsApp, which will later populate your software?
It can get integrated to the software, but if you want to get some kind of a health record into a system, you need to have it through a kind of a module of an app, rather than you can integrate the WhatsApp data into this app also if required.
No, but why would you necessitate for the patient, every patient to download our app? That's my question.
Because the data of the patient, what is recorded, is going to be stored in the app. Okay. In WhatsApp, we don't have the credibility for that, right? That's number one. And there is an additional feature in this, which is a reception app, which I've told you, where the reception or the secretary of the doctor can book the appointments for the patients in terms of follow-up. So the doctor or patient need not have the burden of booking the appointment. It could be booked by the reception itself. Thank you, sir.
I request Dr. BNR Subudhi sir to give the Prasanth certificate.